Hi, welcome to another one of our Dr. Foot videos. This video is about 7 words. 7 words that I think no podiatrist, no physiotherapist, no doctor should be scared to use. Before I talk about these 7 words, I want to give you a little bit of context. I've been a podiatrist for a very long time. And in about 99% of cases, I'm really confident about my diagnosis and the management plan. That could be from MSK biomechanical patients, sports injury patients, or normal podiatry patients, patients with dermatological problems. I'm pretty confident about how I'm going to take a patient from A to B and what kind of management plan we're going to put into place. And I will build in contingencies within that management plan. However, occasionally I'll have 1% of a patient where it will stop me in my tracks and I'll say, I think I need to think about this. And those 7 words that I tend to use with those patients are, I don't know, I will find out. The reason why I think these words are very important is there's such a large expectation on health professionals to have the answer to all the health problems that a particular patient is going to present with. And it's understandable. Patients put a lot of emotional energy into seeing a health professional. Sometimes they've thought about it for a long time and they've thought, can I manage this myself? And eventually it gets to a stage where they can't manage it themselves and they want to see an expert in that field. So they'll put a lot of emotional energy into visiting a health professional, and they expect that health professional to have all the answers. This is especially for me because I have patients coming from all over the UK to come to me, and they expect Mr. Hussain to have the answer to all of their problems, or their foot and ankle problems. But sometimes I have to tap into my network of radiologists, podiatric surgeons, physiotherapists, and other podiatrists who may specialize in different things to ask for a second opinion. This is where I think it's important that health professionals are not afraid to use those 7 words and say to patients, look, I need to spend some time thinking about this. I would rather say that to a patient than give a patient a management plan that I'm not completely confident with. Because I know many health professionals from various different fields that have done this in the past. They've put a management plan in place where they've either felt under pressure by the patient or they haven't put enough effort into diagnosing the underlying cause of a problem. The reason why I'm making this video today is because I had a patient in a couple of days back who appeared to me and she was complaining about ankle pain, and she was adamant she wanted an injection of steroid injection on the first visit, and she didn't want to leave without the injection. She came to me with an MRI report, a ultrasound report, a blood test report, but the clinical symptoms that I was finding in clinic, my clinical findings were not the same as the MRI and ultrasound report. And the ultrasound that I was doing in clinic, I was finding something else. So I wasn't completely sure about this. I wasn't completely sure how to manage this patient. So I was very honest with the patient. I said, look, I'm not comfortable in doing this particular type of injection right now. I want to think about this. So let me read these reports again. Let me speak to my network of senior consultants, and then if appropriate we may pursue this in a week or so's time. And the patient was really understanding because I think she realized I was being honest with her, and I was saying I'm not sure. So I think it's important, if you are not sure, if you are not 100% confident about the clinical diagnosis, then a health professional should seek the opinion of senior peers, people who may be able to shed some light on a particular condition. Hope you found this video helpful. I'm really enjoying making these videos, and this particular video, I think it strikes a chord with me, because I think there is such a pressure on health professionals to always have the answer, and sometimes we need to take a step back and say, let us think about this, and then let us come back to you and give you a management plan that we can all be happy with and we can all be confident with. Hope you enjoyed this video, and I shall speak to you soon. Thank you. Bye.